What's up, beautiful people? We are back with another patient journey. This is a series where I discuss things that I often hear from patients. And this was again in the big box clinic. I am picking up more of those shifts these days as I work on building my own clinic. But this patient came in and I immediately walked in the room. They were apprehensive. She was a 70-year-old female, and it said that she was there to talk about weight loss. And in the conversation, I found out that she had been on compounded tirzepatide, and the compounding pharmacy she was getting it from was no longer compounding it due to the FDA saying it was no longer in shortage. And she wanted to go on prescription Zepbound. Zepbound had actually worked for her husband. She herself had actually lost 9 pounds on the compounded tirzepatide. She was ready to increase her dose, and she had started lifestyle measures. She was working out, she was feeling better, but she was a little apprehensive. And so we went into the conversation. I just kind of talked about it, said, "Hey, are you having any side effects?" Went through the whole spiel. She was doing well on it. And I said, "Okay, it's about time that we increase your dose. It's been a month, so we can do that. It's always best to combine this with lifestyle measures." And she told me about the strength training and exercise that she was doing, and she was feeling pretty good doing that and seeing improvement. And then we talked about some nutrition things. And I always mention protein and fiber are, for me, the things to prioritize with mostly whole foods. I like the 80-20 rule. So at least 80% of your total calories should be primarily whole or minimally processed foods. And then we have 20% from our discretionary things that we enjoy, but may not be the most nutritious, right? And then I gave her some tips on incorporating more protein. She loved the Greek yogurt. She was already doing that with protein powder. We talked about fiber, things like edamame, things like the mission tortillas that I frequently talk about because they're an amazing source of fiber. We talked about ground flaxseed, cacao powder, all these little things that I put in my ebook. And she was eating it up. In fact, she was my favorite type of patient. When they pull out notes when you're talking to them, I absolutely love it because they're engaged, they're getting feedback, they're taking down things that they're going to use later. It's why whenever I talk about things that patients can do to make the talk or visit with the physician easier, I always say bring a journal, bring notes, bring paper, write stuff down. I prefer people write stuff down than use their phone. But if all you have is your phone, that's great. There's a lot of information that gets talked about between the doctor and the patient. And unfortunately, most big box systems are not done so in a way that that information gets captured and actually put in their chart in a very meaningful way that people can go back and cross reference, right? Now, in my practice, my patients get a spreadsheet. It is HIPAA compliant. I sign a BAA with Google, and we use that spreadsheet to track everything, to talk about the recommendations, our goals, right? But we can't do that in this clinic that I was working in. But it was an amazing experience. I gave her some tips. We kind of talked about life, what was meaningful for her. She was 70 years old, which was great. I love seeing people in the seventh decade of life still energetic, still eager, still trying, still learning, still engaged with their health and seeing good results. And before she left the room, she said, "You know what? I was really hesitant to come here today." I said, "Why?" She said, "I didn't want to be judged because I was coming in for weight loss medication." Her regular doctor was out of the country, was going to be out of the country for a while, but she didn't want to stop taking the medication because she was having good results. But she almost didn't come in for fear of being judged. And that let me know that this person that had a bad experience with a physician or another healthcare provider in the past to where they felt judged. And there is no place for judgment in medicine. I don't care what you're doing. I don't care if it's illegal drugs. I don't care what it is. There's no judgment with me. Now, I'm going to hold you accountable, and that might feel uncomfortable. If we have goals that we set, I'm going to hold you accountable. I'm a high accountability type person, but I'm not going to judge you. I haven't been in your shoes. I don't know where that's coming from. I don't know why you're doing the things that you're doing until we really dive in. So there is no role for judgment. And it's sad because I see this online when I look at other posts, especially related to weight, how people have been stigmatized even by medical professionals and feel judged about their weight. And you have to separate out the two things. We can talk about weight and obesity and excess body fat, building muscle, all of that from a place of information and trying to holistically approach a situation. instead of judging someone for their behaviors or whatnot. And what I like to do is talk about these things from a place of, instead of subtracting things, here are things that we can add, right? Here are things that we can do, not here are things that we may or may not necessarily need to remove. I found that people respond to that messaging better, but it's really breaking my heart what I'm seeing now that I'm in the big box clinic more, that these stories from these patients about their experience with the medical system and how tragic it is. And especially for this woman who was seeing results, doing well, and almost stopped her progress because she was afraid of coming in because of weight stigma or stigma that she may have experienced in the past from healthcare professionals. So, this is just an example of how I handled that conversation. And I hope that more people can have conversations like this with their healthcare providers. It is essential for providing actual healthcare. And I was able to spend a good amount of time with her, talk with her, give her some tips. I sent her a link to my ebook, which had more recommendations. And overall, I felt really, really good about that patient encounter. And I hope she felt really good about it as well. Okay, thanks for listening to me ramble. Y'all have a blessed day.